we quickly try to move to the next surgery. So for the next surgery, we actually spoke about okay, this one is what is known as a posterior sagittal anorectoplasty. Posterior sagittal anorectoplasty. Okay, so they usually abbreviate it as what? PSARP, that's PSARP. So for posterior sagittal anorectoplasty, so that's a definitive surgical procedure, and they use it to correct what? High anorectal malformations. So usually in children. Okay, so it was introduced by Peña and DeVries in 1980s. Okay, and this changed how humanity looked at what? Anorectal malformations. So indications: when will you actually want to do a posterior sagittal anorectoplasty? If the rectum, there's a high anorectal malformation. So rectum ends above the levator ani muscle, often with fistulas to the urinary tract for boys or girls. Okay. Then also complex malformations like cloacal malformations, recto-urethral fistulas, recto-vaginal fistulas. You do this posterior sagittal anorectoplasty. Then probably they have done other surgeries for that particular condition, but it has failed. You always opt in for this. So surgical principles: exposure. So midline posterior sagittal incision through the sphincter complex. So identification. So there is direct visualization of the rectum, the fistula, the sphincter muscles, and the pelvic floor structures. So dissection, this is where you mobilize the rectum and divide the fistula. Reconstruction, the rectum is now pulled through, then placed precisely within the sphincter muscle complex. So anoplasty is when you now create a new anal opening at the correct anatomical site. I have the pictures here which you guys will appreciate, okay, so you don't have to worry so much. Now, advantages of this is there's direct visualization of the anatomy. It will preserve sphincter muscles. It will allow correction of fistulas. It will reduce the risk of misplacement of rectum. Okay. So post-operative care is you just constructed a new anus, so the person will not start using it immediately yet. Probably they can opt in for colostomy for a while. Okay, then they regularly dilate the anus, okay, just to prevent it from blocking again. Okay, so that's what we got for this type of surgeries.